And the UK government has warned that up to a quarter of the entire workforce could be absent because of COVID. The UK has seen record numbers of new cases over the Christmas period, and contingency plans are being drawn up to help keep key services like the NHS operating. Joining me now live from the UK is frontline doctor, physician and researcher with the NHS, Dr. Veer Pushpak Gupta. Doctor, good morning. Thank you so much for joining us. Firstly, what sort of pressure is the NHS currently under?
And good morning to you, Danica, and good morning to all the viewers in Australia. Well, we've been under a lot of pressure throughout this pandemic, but it's come in waves. At the moment, we're seeing 200,000 cases a day and about 10,000 hospitalizations all across the United Kingdom in NHS hospitals. This is the highest it's ever been since March 21, which was sort of the end of the second or third wave last year. And so you can imagine that Delta obviously was a fast transmissible virus with higher severity. Omicron, a super fast transmissible virus with lower severity, but still causing high numbers of hospitalizations, up to 10,000 a day, out of which some people might even need ICU. And what that does is that it overwhelms the health system quite fast. It delays elective procedures, like you mentioned in your show just earlier, and it obviously causes problems with staffing because we have a lot of staff that is now not working at the moment or self-isolating because they're showing symptoms or they're positive with Omicron. So yes, a lot of problems in the NHS at the moment, but we've been there before and we've come out of it before. So I'm positive that this can also be overturned.
That's really good to hear. Just on the workforce, the UK government has warned that up to a quarter of the entire workforce could be absent because of COVID. What does that mean for doctors and nurses?
Yeah, it's been a struggle all throughout the pandemic. We've had medical staff that is on leave, medical staff that has been infected, medical staff that is mentally fatigued. And that is the most important thing to think about. I mean, we've been fighting this virus now for 2 years. Annual leaves have been canceled. Study leaves for junior doctors and trainees have been canceled over time. There are a lot of doctors that have not been able to see their families, especially families that live abroad outside the United Kingdom. So it has taken a toll on medical staff. It's taken a toll on doctors and nurses. And I think something will give at some point if this continues. So we do need help from the government. And we do need to bring this up and make this an issue that is known to the public, that doctors and nurses will require some sort of support down the line, especially if these kind of numbers continue.
What sort of a trajectory is the UK on? We look at South African data and their cases rose quite significantly. They peaked and suddenly it's now on a downwards trajectory. Is the UK expected to follow that path?
Well, it's anybody's guess, Danica. I mean, Dr. Fauci from the United States made a statement recently saying that hopefully the United States and the United Kingdom will follow a similar trajectory to South Africa. But if you look at the numbers, they say otherwise. I mean, we were dealing with about 50,000 cases about 3 weeks ago when Omicron was first named as a variant of concern. And now we're dealing with 200,000 cases a day. And it's mostly centered around London because it's a highly dense city. But even in other parts of the United Kingdom, we're seeing a lot of cases. And so it's anybody's guess. But hopefully, as the trend has shown in previous variants, that there is a peak and then it does come down. My concern is that if Omicron and Delta rage through a unvaccinated population, it can combine to form an even deadlier virus, which has the super fast transmissibility of Omicron and the severity of Delta. And that's why we're in a rush against time to get everybody boosted before the deadline that Boris Johnson had set.
Yeah, it's certainly going to be a big effort. Dr. Veer Pushpak Gupta, live for us in the UK. Thank you so much for joining us this morning.
Thank you for having me. Thank you.